Hello, Trinity family. This is Donna. As many of you know, I'm an internal medicine physician and chair of the coronavirus transition team. I want to speak to you today about where we stand with COVID-19 and what the future may hold. The main message I want to share is that even if you're fully vaccinated or you've recovered from COVID-19, keep wearing your mask and distancing. And if you haven't yet received the vaccine, please get it as soon as you're eligible. The reason we must continue with the masks is that with vaccination, we know you're protected from severe illness and death, which of course is great, but we don't know whether the vaccine prevents your getting a mild case of the virus and spreading it to others. There's also concern that the vaccine may be less effective against the new variants of the virus that are now rapidly spreading across the country. So even though the recent decline in new cases is a cause for celebration, it's much too soon to discontinue the COVID precautions. For those who've had the illness and therefore should have immunity, the concern is that we don't know what level of natural immunity the illness actually confers or how long it lasts. And it appears that the new variants may be able to infect even those who've already had COVID. So again, all the precautions, masks, distancing, hand hygiene, avoiding crowds and gatherings are needed. Today, Monday, February 22nd, as I record this message, the United States will reach the sad milestone of 500,000 Americans dead of this disease. The recent decline in case numbers worldwide and in the United States is heartening, but the reason for it is unclear. Not enough people have been vaccinated at this point to cause the decline. About 56 million people in the United States have gotten at least one dose. Also, the number of tests done was down significantly recently because of the heavy winter storms that hit much of the country. If you don't do the tests, you don't find the cases. Those storms also, unfortunately, disrupted vaccine administration. But the heartening news is that cases are down, and vaccine distribution has ramped up. We're racing to vaccinate enough people rapidly enough to develop significant herd immunity before the virus mutates to the point that the vaccines don't work. The new UK variant, B.1.1.7, is more transmissible and more severe, and it's rapidly spreading in the US to the point that it's probably going to make up 80% of cases by the end of April. So far, our vaccines do work against it. However, the vaccines are slightly less effective against the South African variant, B.1.351, which in the United States was first detected in South Carolina. And that variant is causing COVID-19 overseas, even in people who previously had COVID. There are at least two other new variants circulating in the U.S., one first detected in Brazil and one first detected in California. The more people who get COVID, the more the virus can mutate and the more variants we will have. The messenger RNA vaccines can be rapidly modified for new variants, but in the meantime, we have to keep wearing masks and distancing to halt the spread. Other countries have taken different approaches. In the United States, we're counting on each person to practice the needed precautions of masking and distancing, which about 75% of people say they're doing. But we need that number to be 95%. And we're counting on the vaccine, and that's a race against time. The good news is, if all goes as planned, every American should be able to be vaccinated by sometime this summer. There have been articles in the news recently about double masking, which you can do if you wish. But really, a snugly fitted single mask made of at least 2 layers of tightly woven material is effective. If you purchase N95 masks, they need to fit so tightly around the nose, cheeks, and chin that they can be very hard to breathe through. With any mask, if it doesn't suck in toward your mouth when you inhale, it's not tight enough. It's too bad that masks have become a political statement. A mask is a life-saving medical device and should be regarded as such. Many lives have been lost because this simple fact was not recognized. What does the future hold? In the long term, the SARS-CoV-2 virus is not likely to go away completely. In fact, We've never completely eradicated an infectious disease that had animal hosts in addition to human hosts like this one does. It will probably wax and wane the same way that colds do. They're also caused by the coronavirus. We will develop some natural immunity, either through contracting the disease or through the vaccine. The virus will probably mutate at some point so that new vaccines will need to be developed and administered. But we have the technology and the recognition of the need to be ready this time. In the short term, our case positive rate needs to get below 5% for us to be able to safely resume indoor gatherings, and it is at 14% in Greenville County right now. But I'm hopeful that it'll continue to decline so that we will soon be able to worship and gather in fellowship together again. I miss you all more than you can know. In the meantime, please keep safe, keep up the precautions, and keep the faith. Thank you.